Robert Bache, Medicare Bob here on this FAQ Friday, owner of Senior Healthcare Direct. And in this video, I'm really excited because I'm going to go over with you the 10 things you need to know about the new Medicare Red, White, and Blue card. That's right. The government announced it a few years ago that you will be receiving a new Medicare card. And starting in April of 2018, Medicare is going to start mailing out those cards. Medicare recently posted a document to share with you the 10 things you need to know about your Medicare card. I'm going to have that document scrolling behind me, and I'm going to go over it with you in this video. The first thing you need to understand about the new Medicare card is mailing does take time. So your neighbor might get their new Medicare card before you. You might get your new Medicare card before your spouse. They have a way they're going to mail them out, and it's just going to be random. So you might get your card different than your neighbor or your friend. So don't panic if you don't receive your card exactly the same time as your friend or neighbor, or even within a week or two of your friend or neighbor. They are estimating that it's going to take a year to mail everybody their new Medicare card. And again, they're going to start this in April of 2018. The second thing you need to do is once you receive your new Medicare card, you need to destroy your old Medicare card. For a lot of you, your current Medicare Red, White, and Blue card includes your Social Security number. So, which is why they're doing these new Medicare cards. So when you get your new Medicare card, you need to destroy your old one. Do not just throw it away. Okay, you want to treat it almost like a credit card that you're getting rid of. So you want to either shred it, cut it up, get rid of it, just protect it when you throw it away, because as you know, it most likely has your Social Security number and you want to protect that. The third thing you should know is you want to guard your new Medicare card. You only want to give your new Medicare number to doctors, pharmacists, healthcare professionals, your insurance broker or insurance professional that you're working with. So you really want to guard that card because that's going to be your new Medicare number. The fourth thing that you want to understand is your Medicare number is going to be have a unique number. So instead of using your Social Security card, it's going to have a unique number that has been assigned to you. Kind of like your driver's license number, how it's just a randomly generated number, but that's your driver's license number. Same thing with your new Medicare card. It's going to have a randomly generated number that's going to belong to you and only you. The fifth thing Medicare wants you to know is your new Medicare card is going to be paper. I know a lot of you have requested and wanted it to be laminated. Unfortunately, Congress says that's going to cost too much money to do that. That's the reality of it. What they're saying is it's easier for your doctors and healthcare professionals to make a copy of a paper card. That doesn't really make sense to me because a laminated card copies just as well as a paper card, but we'll roll with what they say. The point is it's going to be a paper card, not a laminated card, which is what we were all kind of hoping for. The sixth thing you should know is you want to carry your card with you. That is your new Medicare card. So your first few times you go to the doctor, if you go to the hospital, whatever you want to do, if Medicare is your primary insurance, this is your new Medicare card. So you're going to want to carry it with you. And now that it's not your Social Security number, most of us should feel safer carrying it because, you want to protect the number, but if the number gets out, it's not like someone's going to be able to steal your identity with that number. The seventh thing you want to understand is doctors and medical professionals, healthcare professionals like us, we understand and know this is coming. So it's not going to be, it's not going to catch your doctor off guard or their office when you say, hey, I've got a new Medicare card. You're going to want to, but when you do get it, you want to present that to them because that's going to make filing claims easier. But as I mentioned in my last video about this, there is going to be a transition period. So healthcare professionals, insurance companies, everyone's going to be kind of using both numbers for a while. But so your doctor knows it's coming, so they won't be caught off guard. You can find your number. So here's the good news is if you lose your card, you can order a new one on Medicare's website, but also healthcare professionals like us, we will be able to look up your number based on your date of birth, your name, your address, a couple of personal identification questions that we can ask you. We'll be able to look up your number if you were to lose your card. Something very important for people that might have a Medicare Advantage plan. So if you have a Medicare Part C, Medicare Advantage, sometimes these are called Gold Plus or Medicare Complete. If you have a Medicare Advantage plan, you still want to carry your Medicare Advantage card with you. So if your Medicare is not your primary, meaning you don't have Medicare and a Medicare supplement, if you just have a HMO, PPO, Medicare Advantage plan, the new Medicare card's not going to replace that. Your carrier still wants you to carry your Medicare Advantage plan card. So that's the card you'll still give to your doctors. So if you get your new Medicare card, you can just put that in a safe place for now, just in case if you ever upgrade to a supplement later, you have it available. There's going to be lots of confusion, okay, over this. There's going to be lots of questions. Medicare provides behind me a phone number that you can call, which is Medicare's phone number, the 800-633-4227, which is 1-800-MEDICARE. You can call them and ask questions about this. But to summarize all this, new cards are going to start going out in April. They're going to arrive at different times, so don't panic if somebody gets there sooner than you. When you get the new card, throw the old one away. Shred it though. It's got your social on it most likely, so you don't just want to throw it away. You want to shred it, cut it in pieces. Do how you would, get rid of a credit card basically. Shred it, get rid of it. But you want to get rid of the old one and carry the new one with you. Your doctors know it's coming, so when you have your new card, carry it with you, provide that to them. And if you lose your card or something, you can order a new one. Also, healthcare professionals and medical professionals will be able to look up your card number based on a few personal questions that you can provide. And the other thing is, if you have a Medicare Advantage plan, the new card's not going to replace your Medicare Advantage carrier card. So when you get your new card, put it somewhere safe and continue to use your Medicare Advantage plan card. Please like, share this video, subscribe to my videos on YouTube. Medicare Bob, it's corny, but I go over everything Medicare all the time, so I keep you up to date. I like to empower everyone with Medicare knowledge to make your life a little easier. If you have any questions, our phone number is listed below. Feel free to call my office, and we'll always be happy to help you.